Well, welcome everybody. I'm super excited to welcome you to this number 2 in our Fireside Chat series. And today we're going to be talking about practical ways to support employee mental health. So I'm coming to you today from Vancouver, BC in Canada. It is Mental Health Week in Canada. And Vancouver is located on the traditional and unceded territories of the Squamish, Tsleil-Waututh, my apologies, and Musqueam people. I also want to give a special kia ora to all the folks joining us from New Zealand. I know that there's a large number of you, so thank you for taking the time to join. I'm also so excited to be joined by Dr. Georgi Toma. And as we're letting some more people into the chat, I'm just going to let Dr. Toma go ahead and introduce herself.
Thank you, Kate. I'm so happy to be here with you this morning. In Oakland, it's 9 a.m. in the morning. And so my field of expertise is mental health in the workplace. I do this both as a consultant and as a researcher. Through my research work and my practice, I created a mental health protocol, a system, a step-by-step program called the Wellbeing Protocol that's been shown in research to reduce stress by 58%, reduce burnout by 60%, and improve mental well-being by 103%. I work with organizations to help them identify psychosocial hazards, to help them identify ways to mitigate them, and to have concrete evidence-based strategies to support the mental health of their employees so that they not only meet their legal obligations, but also they create a culture where people thrive and business thrives. So that's me in a nutshell.
Fantastic. And I'm a healthy aging specialist. I'm a community-based health promotion researcher. I help organizations and government plan for an aging population, but I also spent about a decade in disability management, vocational rehab. But nowadays, I spend the bulk of my time helping organizations to support, retain, and recruit their midlife and older female staff by becoming more age-friendly. And when I say female, I mean everyone who identifies as female. So I think that's important to note. So from here, I think we're going to start by just going through some background about the topic today, a little bit about the aging workforce, and then we're going to jump into some of the questions that have been posed to us prior to the session. So we'll get started maybe with me just giving you a little bit of background around mental health in Canada. And I know folks are joining from all over the world, but I'm going to give you some of the Canadian statistics, and there will be some more information about different countries as well as we move along. So in any given year in Canada, about 1 in 5 people are experiencing mental illness. And by the time that we reach the age of 40, 1 in 2 of us will have or have had a mental illness. So it's a pretty significant issue in Canada. It's also the number 1 cause of disability along with substance use disorder. So that's a pretty significant issue for workplaces as well. And we know just in terms of the cost around this for workplaces that when folks have a workplace disability related to mental health, that's actually about double the cost of a leave related to physical health. So it's a really important issue for so many reasons. So on top of this, you'll notice that this Fireside Chat series is about women in midlife. And so I want to talk a little bit about why we talk about midlife and why the aging population at work is so important. So I just want to start with giving you a little bit of context. and give you the context around what we call prime age employees. So these are folks between the ages of 25 and 54. So not in midlife, just that prime age working group. And we've been losing that group from the workforce for in a pretty steady stream for many, many years, and in a very equal rate between men and women. And that's high enough that right now there's about 1 in 8 men that are out of the workforce in that age group. And that's actually higher than during the Great Depression. So it's a pretty significant issue, this employee loss. But that was a steady stream, leaving behind a solid majority of folks in the workforce until COVID. With the COVID-19 pandemic, the rate of women leaving the workforce has accelerated really substantially, and especially women in midlife. And we'll talk a little bit more about that as we go along. So essentially what we have going on is we have a shrinking workforce and we have pretty massive population aging. I'm interested in the population aging piece because I think this is a piece that's being a little bit missed by some employers. And just to put this in context for you, in 2016, so that was one of our last long form census years in Canada, the number of folks who were 55 and older in the workforce was about 36%. And that is the highest that it has been since we've been collecting records. And that portion of the workforce is projected to increase to 40% by 2026. So again, it's a pretty substantial issue in our working population. One more piece of context for you. Back in 1996, we had, for every worker who was 55, we had about 3 workers who were between the ages of 25 to 34. And nowadays we're at a 1-to-1 ratio. So a very large portion of our workforce is in that aging population. And interestingly, in all of this, one of the fastest growing demographics is women over the age of 55. And in fact, projection is that by 2026, that 1/3 of all new hires will be women in this age group. So hopefully that puts it in context for you a little in terms of the aging population, and then that midlife piece. I have to say, the question I'm asked the most is, what is midlife? How do we define that? And I wish I could give you a really neatly defined answer, but in research, it really varies between sort of 35 to 54 or 40 to 60, depending on the papers that you read. But we can assume that in Canada, the average age that women live to is about 84. So midlife, we're typically thinking early 40s to mid to late 50s. That's how we're defining it. So that group, that midlife group, is one of the biggest threats to employee loss in 2022. And just a few weeks ago, I was talking about this issue, and the number that I was using was about 32% of women are planning to exit the workforce in the next year. But you might be surprised to hear that just in the last week, there was a new survey that was released by Deloitte. And our number is up to 50% of women who plan to leave in the next 2 years. And only 10% of those women surveyed, and now these are women in 10 different countries around the world, only 10% of those women plan to stay with their current employer for the next 5 years. So women are leaving at a bit of an alarming rate. And then an overlay on top of that is this idea that in the last year, there's really been an acceleration in people in midlife leaving the workforce, to the point that, you know, they're now coining the term the great midlife resignation. And the last piece of bad news, unfortunately, is that C-suite women are leaving at the highest rate of all. So we are losing a tremendous number of mentors and leaders in this loss with women. So that's a bit of the context for you. I'd like to start, I guess, with our questions. One of the first questions was around how have things changed for workers' mental health over the past few years, and what has happened considering the pandemic? So I'll just say very briefly, and then I'll turn it over to Dr. Toma, that in terms of women in this group, 53% surveyed say that their stress levels are higher than they were even a year ago, and half are suffering from burnout. Half are saying that their mental health is poor or very poor. And yet only about 43% of them feel comfortable talking about mental health at work. And the other piece that I need to mention is the intersectionality of this topic, that this is impacting folks in the LGBTQ plus community, the BIPOC community, those living with disabilities at a disproportional rate. So that's something also that we need to focus on. So Dr. Toma, I'm going to turn it over to you and have you maybe comment on how things have changed.
Yes, absolutely. And so you know, it's absolutely correct in saying that COVID-19 has led to an increase in mental distress, in disorders such as anxiety and depression. And so I'll be sharing with you some articles. I'll be sharing with our audience some articles after the webinar to look at specific stats. But what we have seen is definitely an increase in stress-related disorders, right? So there's an increase across the population in stress. So that means we've seen higher rates of anxiety and depression. We've seen also something that was called the post-COVID stress syndrome. That was quite high in 2021. Hopefully, it's starting to decrease this year. But what that means really, it is stress caused by different factors related to the pandemic, to either the measures that we've taken to protect ourselves from getting infected, or the repercussions of the pandemic on our job, and so on and so forth. And just to give you a quick view of what's happening, for example, in you were mentioning at the beginning, Kate, that in Canada, 1 in 5 people suffer from a mental health condition. Well, the stats are the same in Australia and New Zealand, and actually in Australia, it's 1 in 4 people. But the stats are very similar. So it's very important for us and for organizations to understand that at this point, there is high likelihood that in the workforce, people feel more tired, more irritable. Yeah, so I'm just talking about the symptoms that you can observe in your staff, right? You can see people can be more short with each other. And in fact, interestingly, what we've seen post-COVID is an increase in incidences of incivility in the workplace. So incivility means those moments of disrespect, those ambiguous moments when a colleague makes a comment, when a manager makes a comment. This is very significant because incivility leads to further increases in anxiety and stress and leads to resignations, right? So the Melbourne Institute, just the final piece, and then we can move on to the next question. The Melbourne Institute runs a survey, for example, what measures the level of mental distress in the Australian population. And post-COVID, we've seen more than a doubling of that statistic, right? So from memory, before COVID, we had like a 10% high rates of mental distress, and then post-COVID, it was up at 25%. And in New Zealand, the numbers are very similar. So I'll just give it back to you, and we can move on to the next question before we bring everyone down with these depressing statistics.
So my next question for you actually is just helping us understand what burnout is exactly, and how is that different from other mental health conditions?
Yeah, and that's a good point. So there's a lot of talk about burnout. There's a lot of statistics that came out around that. So for example, the McKinsey Institute has published a survey that they've conducted across employees from the Americas, like North America, Europe, Asia, Australia, and South America. And we've seen overall that 50%, so 49% of employees reported having burnout symptoms. So that's really significant. So when we think of burnout, the World Health Organization defines burnout as an occupational hazard. So it's related to the workplace. So it's an occupational hazard resulting from chronic workplace stress unsuccessfully managed. When burnout has three main dimensions, right? We talk in the research done on this syndrome, we have three main dimensions. The first one is emotional exhaustion. So for most people, the first symptom they would feel is that of fatigue. So a lot of people, when they hear emotional exhaustion, they think it has to do something with emotions. Not necessarily. It's just the way the term is phrased, but the way the symptoms are experienced by both men and women is through tiredness. You wake up in the morning and you feel tired just thinking about work. You don't have the energy to meet your workplace demands successfully, and also you don't have energy left at the end of the day for your personal life. The second dimension is depersonalization or cynicism. What that means in practice is that you become disengaged from your work. You don't believe your work really has any meaning or value. And the third dimension is that of low personal achievement. So you feel that you are ineffective at work, and over time you actually become ineffective at work. Now, it is important for us to discuss two things. One, that there are different ways in which people experience burnout. So let me give you some examples. Burnout can start off from a desire to prove yourself at work. Right? You feel a strong need to prove yourself at work, so therefore you work harder. You start to ignore the signals that your body and brain are sending. You start to ignore, you push it, you push yourself, you make yourself work hard. It's like, oh, I'll just, if I get through this week, if I get through this month, right? That can be a symptom that something is off balance, that you are going in the direction of burnout, right? So I'll just leave it at that, just because we have a lot of questions to go through, but I think that gives, the difference between burnout and a condition like anxiety or depression. So when we look at anxiety and depression, we can talk about a mood versus a diagnosis, a disorder, and we talk about intensity. So with anxiety, perhaps just to put it in plain language, you would experience a constant worry, and it's not even clear what you are worried about, what you are afraid of, right? So it's like kind of a generalized worry. And therefore, for example, when you get an email from a client saying, demanding a deadline that's very tight. Now, your reaction, your nervous system has a very strong reaction, right? A very strong worry reaction, a very strong fear response, right? And so that causes high levels of stress. So that's, for example, when the way you respond to stress can really set you on a path towards burnout, towards anxiety. Now, depression, it's important for us to say that there is a link between burnout and depression. They often are seen as developing either in conjunction, or one being the precursor to the other, right? So I'll just leave it at that, just for us to move on, just in the interest of time. But the article that I will share explains this more, so people who are interested in this specifically will be able to get that information.
That's great. The next question is just around the cost of the mental health crisis for business. And I can speak just very briefly about that and then turn that over to you. When we think about, especially in this midlife group, in this group of women, that, as I've mentioned, there's an enormous cost in terms of employee retention and overall workforce retention. There's a loss of institutional knowledge. There's a loss of leadership. There's a loss of role models. So many costs that we can't necessarily quantify. But then we can also look at the cost of absenteeism and the cost of presenteeism. So when employees are at work, but they are not really able to fully engage with their job. And then there's, of course, the cost that I mentioned earlier, this, 2 times the cost compared to physical health disability leaves in our short-term and long-term disability claims. So again, a really significant cost to business. And I'll turn it over to you.
Yeah, absolutely. And so we've seen that the biggest cost is that of resignations, right? Turnover. And so I've worked with different clients, and usually the cost of turnover is pretty much you take an individual's salary and you multiply that by 2, right? An individual's yearly salary, and so that's the cost per individual of losing someone. That's one way of calculating that. And so that includes the cost related with recruitment, with onboarding, the time it takes someone to actually become efficient at their job. So if you want to put a number, that's one way of calculating it. But I think you mentioned really well, like that absenteeism and presenteeism and loss of productivity are very important. So just here in New Zealand, we have the Institute of Economic Research, and they've conducted a study in 2020, and what they've shown us is that poor mental well-being negatively affects a person's decision-making and productivity for 12 weeks per year. That's 3 months lost every year. That's very significant. So, yeah.
So the next question, or what we, set out to talk about, is what can employers do? So maybe I'll let you start with this, and you can take us through some of the things that employers can do.
Yeah. So I think we need to start by looking at what psychosocial hazards are present in our workplace. That's not only a legal obligation, but also a moral obligation. So what do I mean by this term, psychosocial hazards? This encompasses elements of the workplace and of the work design that can negatively impact the mental well-being of our people. I will give you some examples. Workload is possibly the most obvious example, but I want to give you perhaps a more refined understanding of that. So it's easy to say, well, high workload is going to lead someone to burn out. I wish it were that simple. It's not always that simple, because what we've seen is that different individuals respond differently to an increased workload. So what we need to take into account is what are other areas of support that are present or absent in that particular context. So I'll give you an example. Perhaps we have an individual that can manage a high workload because they have strong social support networks with colleagues and with their manager. Also, when we talk about high workload, how do we define that? What is the limit that is tolerable for someone? Because we need to understand that if we go over that limit, any individual will inevitably burn out if they are subjected to high job demands and low resources for a period of time that is for some people, it could be 2 weeks. For some people, it could be a month. So you need to understand, when you monitor psychosocial hazards, you have to have a more sophisticated way of investigating that so that you understand what it is specifically that can be a hazard to a particular individual. So workload is one issue, autonomy at work, issues of respect, incivility, harassment. So that's issues that have to do with culture. And then issues that have to do with management, the relationship with management. These are just some examples, but they are the most significant factors that are related to burnout, both positively and negatively. So what I mean by that is, for example, it's been shown that a good relationship with your manager can be an incredibly powerful protective factor against burnout. equally so, the opposite can be a direct pathway to burning out and resignation for individuals. One other thing that I want to mention is, how do you think about mental health training in your organization? And is that as important as safety training? Because think about it this way: if you have a worker that handles dangerous substances, you don't make it voluntary for them to go through a training that teaches them how to handle those substances well, right? That's not voluntary, that's compulsory. So I would like us, and actually it's not just me, but there's a whole movement that talks about the importance of having mental well-being training as compulsory, as a compulsory element for part of onboarding. And so what should this mental health training contain? Well, very simply put, there's a series of strategies for emotional regulation. And, I wish we learned this when we were children, but unfortunately, our educational system and our parents don't necessarily have the skills. We haven't been taught these things, but it's very important for us to learn about emotional regulation, to learn to understand how to perceive our limits and when to put boundaries so that we allow ourselves the opportunity to recharge. And very importantly, to deal with a series of cognitive distortions that all human beings have. So what is a cognitive distortion? Just very simply, all of us in childhood misinterpret things that happen to us. And based on those misinterpretations, we form a series of beliefs that are not accurate, beliefs that later on in life have a negative impact on the way we view different events in our life, and they cause us unnecessary stress. It is important for all the population to be aware of the existence. And there's lots of research. There's a core of 12 cognitive distortions that all human beings have. And so you need training just to be aware of that. And just, I guess the last thing that I'm going to mention is, when you think of your well-being strategy, a couple of questions that emerge is, where does it sit? Does it sit with HR? Does it sit with health and safety? Right? Particularly in Australia, New Zealand, we have regulation coming in stronger around monitoring psychosocial hazards and doing something about that. And we see that HR and workplace health and safety teams need to collaborate to get a unified way to monitor and to intervene. And when you choose a well-being intervention, be mindful of what you choose. There's a lot of offer right now out there, and not everything is based on research evidence. So ask your provider, where is the research? What is your program based on? Where's the evidence? So I'll just give it back to you, Kate.
Those are such great suggestions. I have some maybe zoomed out suggestions as well of what employers can do. The first thing that comes to mind for me is really making mental well-being a priority. And we talk about mental health a lot. I think it comes up a lot around workplaces, but really committing to a well-being strategy. And around that, having leader training, working to reduce stigma. We talk about that a lot as well. We're not doing 100% on that, but continuing to work towards reducing stigma. As I mentioned, this idea that there are this large number of women who are reporting issues of mental health, and yet they don't feel comfortable talking about it in the workplace. So I think that one's important. And then having the appropriate supports, as Dr. Toma mentioned. I would also say, from this group of women that we're talking about, really making flexible work for them. So in this same survey that I mentioned earlier, women reported that their stress levels have actually gone up with flexible working, because there's a bit of a fear that if you are asking for flexibility, you're putting yourself at a disadvantage in the workplace, that you are taking away from your ability to move into different roles in the organization. So really, I think acknowledging that when women are asking for flexibility in their work, that will also be a safe place for them to be able to advance as well. And then thinking about workload around flexibility. So you've provided this remote work option or flexible hours, but have workloads changed? Because people's lives, as everyone knows, are not the same as they were a couple of years ago. And in the group of women that I'm highlighting, this midlife group of women, their stressors, or what we would call their allostatic load, so just the collection of stress that has built up and is now affecting their health, is higher than ever. And so just thinking about that when assigning workload, along with these flexible work situations. I would 100% agree with Dr. Toma around using an evidence-based approach and really requiring that of your providers. Is what you're offering based on the most current research and best practice? I think that's so important. From my health promoter standpoint, I immediately think about equity. Who is being missed in your programs, and really seeking that out? Who is not taking advantage of the program? Who is not represented in the program? That's extremely important. And along with that, thinking about the bigger structural pieces that are contributing to some of these things. What is the workplace culture? What is the leadership demonstrating? What are some of the bigger structural pieces? Just as an aside, just thinking about structure, even the physical structure of how employees are working now is contributing to their mental health. There's been some recent research around increased sitting time and its impact on rates of depression, that we know when people are sitting more, they're at higher risk for developing depression. So when we have all these folks at home who are no longer commuting, no longer moving as much, that's just one other piece to consider. So the bigger structural pieces, I think, are important. And then the last thing that I would mention is when you put any well-being program in place, but especially around mental well-being, thinking about the long game, that we know that in the first year that employers get back about $1.63 on every dollar that they put in on mental well-being programs. But if those programs are in place for 3 years or more, the number is up over $2 for every dollar spent. I think it's $2.22. So not only thinking about it financially, but I think it's really important that we commit to these programs as not a nice to have or a situational part of the COVID-19 pandemic, but really something that we're committing to long term. So those are the things that I can think about in terms of employers helping. So one of the next questions that we had that I thought was so interesting and very timely was this idea around carers. How do organizations better support individuals who are taking a carer role or a caregiving role? And the first thing that I have to say is we really need to acknowledge the impact of caregiving, especially during COVID-19, that it may surprise you to know that there are 4 times the number of people who have left the workforce to care for spouses or grandchildren, siblings, than there are to parents who've left the workforce to care for children. Caregiving is the second largest factor keeping people out of the workforce behind early retirement. So really, really significant. And we also need to acknowledge, at least in Canada, that 2/3 of those caregivers, informal caregivers, and when I say informal, I mean unpaid, are women. And so the folks who are caring for those people, for the most part, are women. So one more of those stressors in that allostatic load. And I'll turn it over to you, Dr. Toma. Maybe you can talk about that a little bit.
Yeah, I absolutely agree. And so when we think of carers, I think a lot has been said about flexibility, and I really like your point, Kate. I think you mentioned it a couple of questions before, around the fact that, for example, for women, greater flexibility might have meant actually an increase in stressors. And so I think we need to talk about how we as an organization can ensure that the flexibility we offer matches the real needs of the person. And so here, I just want to talk about how we can do that. And so some of the ways in which we can do that is creating the opportunity to job craft. I am aware, of course, that not all jobs allow for that space, but working with managers and employees to see if there's an opportunity for job crafting, for greater autonomy, for the employee to choose a work schedule, right? And I need to say that this can happen only in an environment where people feel safe to talk, right? So going back to psychological safety, so we have the two concepts, right? We have Amy Edmondson's psychological safety, and we have psychological health and safety, right, which refers to the psychosocial hazards I mentioned. In some ways, the concepts overlap. In other ways, they are different. That's not really important, but like when you look at it in practice, what you want and what is useful and conducive to productivity and to business growth is a working environment, so a culture where people feel that they are able to voice their concerns. That's the only way in which you can ensure that you actually create a series of policies that work for people, not what you imagine people want, right? And so that's, and I think another thing that I just want to say, just recently I've had this conversation with a client, and then it came up in another conversation with another friend. It's like one of those things you talk about it once, and then all of a sudden a lot of people talk about it. So I don't know if you are aware of this book, The Squiggly Career. So it's very interesting because you are in a corporate world, and we are taught, that when you have a career, your purpose should be growth, right? You should be looking year on year to grow, to get a promotion. And if you don't do that, well, you're doing something wrong or you're failing in some way, right? And I think also, I mean, if you look at the performance review process that most companies have, right? The idea is, oh, you've got these KPIs, you got to perform, you got to get the bonus, right? And at some point, that can be so exhausting, so demotivating. And what about, the conversation went like this, what about just maybe this year I just want to cruise, It doesn't mean that I'm not effective or I'm not efficient at my work. No, I still take pride in my work. I still want excellence in my work, but maybe this year it's okay for me to just cruise, or maybe it's okay for me to make a lateral move. So I'm not earning more money. It's not considered the traditional like direct line, but it is okay for me to make this lateral move, maybe to look after my mental well-being. So I don't have to quit my job to look after my mental well-being. So that is not a choice between the two, right? Or a choice between, oh, I want to look after my family, or I want to have a job, right? So Squiggly Career is a book and also a TED Talk that I highly recommend by two lovely ladies. I don't remember their names now, but we'll put it in the replay email so you guys have it. And it's really about the idea that it's useful for us to move away from the myth of having just like a vertical upward line in terms of our career progression, and more like a squiggly kind of thing that matches the reality of our lives, right? The messiness of life. So that's
such great advice.
Yeah.
That's great advice. I'm going to switch gears on you a little and ask you the next question. Is there something specific that employers can do to support remote workers?
Yes. So this has been a big issue, right? Because when you're not with someone in an office, it's harder for you to pick up on signs that someone is struggling. And on the other hand, you don't want to overburden your people with Zoom meetings or Teams meetings. So it's a fine balance, right? Again, I'm going to come back and say that there are two key elements here. One, the first one and most important is your relationship with your people. So I'm talking to you as if you're a manager, but basically the most important thing is organizational culture. What's the relationship there? Again, if you have a climate where people feel safe, what that means is that there is a greater likelihood that you will hear about problems well enough with time enough in advance for you to actually act, not when they become big problems. Second thing is it is important for managers to have an understanding of their people's baseline. So what I mean by that is all of us as humans have a baseline in terms of our behavior, in terms of our limit of tolerance of stress. And this can be impacted by genetic factors, by childhood, personal history, and whatever's going on in our personal life now, whether we have an illness, whether we have whatever factors, right? So if you have a knowledge of that, then a manager might have the ability to spot warning signs before, but it is really important to offer training to your managers so that they do that. One of the things that I work, that's come up in my work is this, like a lot of times managers are burnt out themselves because it's taken a toll of them to support people through COVID and do their own job, right? And so a lot of times they say, well, I just don't have the resources to look after my team or to become a parent or, to care for them. So it is important in your training, in your organization, perhaps the most crucial training right now is to be directed to middle managers and teach them how to, first and foremost, support their own mental health. And this is through several cognitive therapy. Mild cognitive therapy skills are very useful. Stress reduction skills are very useful. So again, evidence-based approach. Give them those skills and then teach them how they can spot warning signs in meetings. I mean, all managers would have a weekly check-in or a fortnightly check-in, with their teams. So how they can spot it and how they can have conversations, what to ask, so that they don't become a counselor. So clearly that's not their job. What to ask for them to understand if there's a potential sign, and then how to have a conversation with the person to make sure that person feels supported, right? Because sometimes all we need is for someone to listen to us, right? But you need to train your middle managers with these skills because for some humans, they are innate. For others, not. For most of us, not. Most of us need a bit of training and support in that area. And I want to say something, and I think, Kate, you and I, we talked about this before, like when we were working on this panel, we talked about, like you mentioned, how one of the surveys you mentioned before showed that female managers are more burnt out. And the reason is because they took on more carer roles for their teams. And that's just true. So like, at least in my work with all like the companies that I've worked with so far, that has been a reality. So think about that. How are you going to support them?
It's a great point. I'm going to switch gears once again, totally different question. So one of the questions that we were asked was, what strategies should employers put in place to support women who are going through menopause or perimenopause? And so this is a series of fireside chats. This is a series of conversations and very difficult to answer in a short time. So I'll just characterize that as the menopausal transition. That's what we call it. And I want to put it out there again. I know I'm giving you a lot of stats today, but I think this one is important, that, if we think about our female employees, that everyone who has a uterus will go through menopause. Everyone. This is inescapable. By 2030, there will be over 1 billion women worldwide in menopause or postmenopause. And so there's a lot of us in this situation. And I would say if we had any employees who were coming to us as a group and saying, I'm having problems with concentration, there's something going on with my memory, I'm really having trouble sleeping, I've got lower confidence at work, and those employees were at a higher risk for depression and anxiety, they had joint pain, we would really probably take notice that these were important things to address in terms of employee health. And yet, this is what many women are covering up from employers because of gendered ageism. So women are not sharing this because they feel like this is putting them at a disadvantage at work. I spoke to a CEO of a major corporation recently who told me a story about having a hot flash at a board meeting and doing everything in her power to cover that up because it was so unacceptable to have a hot flash in a work setting in that way. So my first thing that I would say, in this, again, in limited time, is just really acknowledging that menopause is going on for this huge group of women. And as I mentioned earlier, this aging population at work. We know that women have a higher intention to quit when they're experiencing menopausal symptoms at work. So just some really practical things, having a menopausal support program, having leader training, again, from a practical standpoint, having later start times because of women experiencing fractured sleep, just for those women who need it. Fans in the workplace help. But again, a huge, huge issue that hopefully we can spend more time in another fireside chat on. Georgi, I have another question for you, and this is one of the questions that was posed to us. Many of our employees have listed burnout as their main reason for quitting. I'm curious about innovative strategies that others have tried.
So what I would say in this context, if there's many that have quit because of that and you have identified that as an issue, I would first look at work design. So I think it's really important for you to conduct a psychosocial hazard audit because I would bet there's definitely something there that is a trigger. So first and foremost, you need to identify what the source is. So I would start by, again, identifying which particular psychosocial hazard it is. It could be a combination of several hazards. And then whatever intervention you take, it has to follow from the data. So first you need an answer. And with the data, I would suggest using using quantitative and qualitative. So what I mean by that is if your organization has a way to monitor psychosocial hazards, that's great. If not, get in touch and create a reliable instrument because an employee engagement survey is not a psychosocial hazard audit. So I can talk more about that. It's part of the work that I do, but yeah. So first you need a tool that looks at that. Then second, in terms of qualitative data is running a series of interviews and focus groups with your people and then analyzing them accordingly so you understand what are the themes, what are the real issues. And whatever intervention you do, again, have it as an evidence base. So I mentioned at the beginning the well-being protocol. Like, for example, I wouldn't recommend going in directly with the well-being protocol or an intervention that is at individual level, because if you've had a group of people with the same problem, I think it's a strong indicator that there's a work design issue there, right? So you need to get to the root cause. Otherwise, people will continue to burn out, maybe at slower rates, but still. So that would be my answer to that.
So again, switching gears, another
Mm.
question is just around what progressive ways might be suggested to engage with midlife women where they are and not where we think they are. I loved this question. And again, it's such a big topic. I wish I had more time to go through some of the solutions. But what it made me think of is this study from 2018, the Seattle Midlife Women's Health Study. And it was really interesting, a longitudinal study looking at how women were managing in midlife. And what's interesting to me is the things that they were reporting are very similar to what Dr. Toma talked about in terms of burnout. So one of the biggest themes was managing multiple co-occurring stressors with limited resources. There were other things like changes in relationships, death of a parent. There's a lot of things going on in this sandwich generation around caregiving, children, a lot of stressors going on for women. So I think, again, the first step around this is acknowledgement. Going back to that idea again of the work design around remote work, hybrid work, how is that working for women and how are you keeping them included? And acknowledging that overlay of age on gender really does have an impact on how women are making decisions and how they feel viewed and heard in the workplace. Women are reporting a higher level of microaggressions than even a year ago. So women are still, I think, not feeling heard and necessarily supported en masse in the workplace. And then finally, I would say around this idea of meeting women where they are is providing well-being programs that are also targeted to them. So are we considering things like menopausal support programs? Are we looking at caregiver support? And even the well-being programs around physical well-being. Women have significant health changes around the menopausal transition. We have changes in bone health. There are all sorts of things going on, not to mention a really big increase in chronic disease risk. So those are important things to consider in our offerings. I wish I had more time to answer that question. Another question that I was asked, and I'll try to answer this quickly because I know we're getting to the end of our time here, is just around some practical guidance around becoming more age friendly and again around age and gender. And another big topic, but just recognizing that only about 8% of DEI programs right now include ageism. This is not really on the radar as much with employers. So even acknowledging and starting to work on a program around ageism, and then that second piece around gendered ageism. This is incredibly pervasive. Women are less likely to be called back for interviews as they get older. They suffer more job losses than men. They have earlier retirement than men. A lot of things are going on around this gendered ageism piece. So really, really important to acknowledge. And then again, recognizing the intersectionality when we add gender and age to race and sexual orientation and disability as well. So all important topics. So we're getting near the end of our time. I would say if you would like to learn more about getting support for some of these issues for your organization, we're going to put up a slide where you can book a call with Dr. Toma or myself, and we can take you through some of the solutions. We can do that separately or together. And while we're putting that slide up, I'm just going to see if we have any additional questions in the chat. I'm just having a look. Dr. Toma, can you see it? Oh, okay, great. Any other questions anybody wanted to add in the chat? If not, we will take just one or two more questions that have been posed prior to the session. Anything that you can see coming in there?
I don't see anything, but maybe we can. Oh, really interesting. I'm noticing more incivility at work, Leslie. Yes, and so I think that's it's an effect of compounded stress, right? So when the stress and burnout clearly diminish our resources, our psychological resources. So people simply become more irritable and they have less ability to control themselves, basically. And that's a lack of, so partly is lack of resources, but partly is also unawareness of emotional regulation skills. And that's across the rise in incivility, across different countries as well. Yeah.
One other question that we had submitted that I think is a really important one, given COVID-19 and everything that's been going on, is just suggestions for supporting employees going through grief.
Yep. So sorry, I was like, I thought you were gonna answer, and then I was like, yeah. Yes, and so I think you're the expert on this one, Kate. My 2 cents really relate around again that really fundamental piece of the relationship and the culture that exists in your organization. Because if you have a culture that is healthy, where there's collegiality and there's respect and civility, what that means is that there is a greater likelihood for the person to feel support. And then, of course, some training around how to have these conversations. And it can be just like a half an hour session. You just tell people, because it's uncomfortable for many people. They don't know what to say, right? You want to say something. What do you say? I'll just give it back to you, Kit, because you're the expert on this.
Yeah, I would agree with what you've said. I think it's that idea that a lot of people really don't know what to say. And again, it's a bit of a bigger training than on our call today. But absolutely creating that safe space in the workplace that people can share and talk about these things as well. Last question, I'm going to try to sneak one more in here in our last few minutes, is just to talk about how to address people who see themselves as perfectionists. I thought this was a really interesting question. Do professionals need to be unemotional because of the services that they provide?
That's so good. Perfectionism. Perfectionism. I'm going to start off right off by saying perfectionism is a form of self-sabotage. So, I speak as a perfectionist myself, right? I've been through this journey. It's like a lived journey. So we need to understand that when someone has this tendency, they expose themselves to a higher risk of burning out. That's first and foremost. And so perfectionism is tied back to a series of cognitive distortions that were formed in our childhood, and these distortions are around what makes me a worthy person, what makes me a good person, what do I need to do, how do I need to perform in order to get my needs met. Basically is that. And so it's the illusion that I have to do something at such a high standard or such an impossible standard in order for me to feel that I have the right to have my needs met. And again, this is formed by a misinterpretation. And I'll just give you one simple example how this can happen in life. You have a family with 2 kids, and the parents mean well, they want to motivate their child to get better grades. And how do they do it? They constantly say to her, why can't you be more like your sister? She gets good grades, she works harder, why can't you be more like her? And that gets repeated over time. And so over time, this person understands that in order for her to feel safe, because parents represent safety for a child, first and foremost, safety, then love, but first safety. So in order for her to feel safe, to feel loved, to feel like her needs will be met, she needs to perform something. She needs to, get straight A's or whatever, right? And so that's just one example of how a cognitive distortion gets created. So I want to say, because I think they mentioned something about you have to be unemotional in the workplace, and that is a big misunderstanding. That's where you need emotional regulation training. So for people to understand that you are emotional when you're dead. So a living organism, but the biological nature of our body entails the existence of affect and emotions. So you can't live without experiencing emotions. And so it is absolutely crucial for people to understand that in the workplace, how do you deal with that in the workplace? So when I talk about emotional regulation, is the ability of a person to retain a state of composure or to ask respectfully for a break when they need to disengage from a situation, right? Emotional regulation entails your ability to understand what triggers you, to understand if it is reasonable, if it is accurate, or if it's a potential misinterpretation. And it is the ability to convey your needs in a respectful way that actually engages conversation. These are skills that can be taught and should be taught, hopefully in schools, but we're not there yet. So then we need to do it in the workplace. And why we need to do it is because of the fact that instances of incivility and disrespect lead to employee attrition. We have the research that shows this. There's no doubt about that. So if you want to retain good people, and if you want your people to be productive, you need to work on this. And there's research around this. Actually, I can send you that paper. It's really interesting. They've looked at a person who experiences one incidence of disrespect, of perceived disrespect. It can be up to 50% less motivated in doing their job. So there's a whole bunch of these statistics that are super scary. So feeling disrespected, it's an important, can lead directly to someone being disengaged and ultimately to want to quit the organization. So it's important, again, coming back, unemotional, that does not exist, right? That's where you need to share some skills with your people. Yeah, that's my answer.
So I think that's a great point for us to end. Thank you so much for all of your wisdom and input today, Dr. Toma. We'll be sending out a recording to everyone who's registered, and we'll follow up with folks who asked questions that weren't answered, because there were quite a few submitted. And just to let you know, there's another Fireside chat coming up on May 17th. Again, Midlife Women at Work, and this time we're talking about rethinking the meaning of well-being and what that looks like in the workplace. So thank you to everyone for joining us today, and we'll be sending out the recording shortly.
Thanks everyone.
Dr. Toma.
Bye, everyone.
Bye.
Have a good way. Have a good day.
Great.